Welcome to the JOWMA Preventative Health Podcast, hosted by the Jewish Orthodox Women's Medical Association. We provide you with up-to-date information on health topics geared towards the Orthodox Jewish community. This podcast content is provided for informational purposes only and is not intended as medical advice or as a substitute for the medical advice of a physician.
Welcome to the Jewish Orthodox Women's Medical Association, or JOWMA podcast. I'm your host, Lisa Minkin. I'm a general pediatrician and proud JOWMA member. And today I'm really honored and really excited to interview someone anonymously for the first time. Before I talk a little bit more about that, I'm going to say, please, if there's somebody you want to listen to, a topic you want to hear, a comment about our podcast, you yourself want to be interviewed, please reach out to us at health, HEALTH, at JOWMA.org. So I don't have an introduction to today's guest because she's going to be anonymous. I will not be telling you her name. I will not be giving you her bio, obviously. I do want to make a couple comments. First of all, if other people listening say, hey, I have a story I want to tell and I want to do it anonymously, I can do that. That's number one. Number two, I'm a pediatrician. I am not a gynecologist. We're talking today about adenomyosis, and which, by the way, this is a more sensitive topic. So it's for mature audiences only. Number three, so because back to number two, because I am a pediatrician, I am not an expert in adenomyosis, which is a gynecological disorder, which we will talk about. I will say that this should be listened to together with the podcast with Dr. Chani Yondorf. Actually, the person I'm interviewing today said, hey, can you please have someone give a talk about adenomyosis, which is closely related to endometriosis. Adenomyosis is often called the evil twin of endometriosis, although someone pointed out that endometriosis is a horrible condition, a very difficult condition, and it makes it sound like it's the nice twin. They're both difficult conditions, but they're both related. And she suggested that I interview someone. I interviewed Dr. Yondorf, who did a great job. And so I do recommend that you listen to that podcast first to learn the medical background, as that is not something I'm going to stop to talk about as much. And also, this is not my area of expertise. I also want to point out that this is my guest's personal story. It's her lived experience. And that's her viewpoint. It is from her viewpoint. It is not from the doctor's viewpoint. And I'm glad to give her a chance to tell us the story. It's an important story on so many points to be learned from it, both by lay people and by physicians and other healthcare professionals. I really think it's important. But some of the things we mentioned, like, for example, she mentioned Beating Endo by Dr. Iris Orbuck, who herself has endometriosis. Was very helpful to her. She also, in this book, has a lot of more holistic / alternative type therapies or ideas. And as a JOWMA podcaster, I present evidence-based medicine. And when something is not as clearly evidence-based, it does not mean it won't help people. And we talked about, do what works for you. I just want to put it out there that say, for example, specific dietary approaches may not be proven to work. It might help you, it might not. And also a very important point about the surgeries that my interviewee talks about. She talks about endometrial excision surgery, where the endometriosis lesions are actually taken out, as opposed to an ablation procedure where they're kind of zapped. So she says you must make sure to get the excision surgery. It is, the one to get, and not ablation surgery. And again, this podcast is for informational purposes only. It does not substitute actual medical advice from a healthcare professional. there is the viewpoint that it may depend. It's not so simple, number one, on your particular medical condition. And number two, what we didn't talk about, but it's really important to point out, is that the type of endometriosis, surgeons who do excision surgery often do not take insurance. I heard Dr. Orbuck speak, and she was talking about how really the reimbursement rate is just not adequate as far as insurance goes, and that's why. But that is, cost is a factor to keep in mind, and I want to be very transparent about that. So I hope people enjoy this talk and learn a lot from it, both physicians and lay people. And if you have any comments, again, please reach out to us at health@jowma.org. Thank you so much for joining me today. I'm really excited to do this with you and to hear your story. So I'm going to let you just go right into it, please.
Okay. I just want to give a little background how this came to be that I am doing this and why I'm doing this. I know that you always ask for ideas, for suggestions, things that people want you to talk about on your podcast. And I think I messaged you saying, I think adenomyosis, endometriosis are really good topics because so many women struggle with that. So many people have those diseases and don't know it or still trying to find the answers. And I don't think a lot of doctors even know enough about it. So I think it would be in fact, that's how I got into this, which I guess I'll get to. And then we were messaging back and forth. And at one point I said yeah, because when I had that, and then I said, oh, I should just tell you my story. And you said, oh, I would love it if you could do that on a podcast. Would you do that? And I said, thought about it. And I thought, you know what? I think I will, because it's just been so long and frustrating. And I think first of all, it'll help me make a little bit of sense out of it, but also, maybe there's something helpful for people who are listening who, first of all, to feel validated, because it can be very, very lonely. It's one of those things where you look fine and most of the time you can function, but you're really in pain and nobody knows how much you're suffering. So, having that can be, can feel less lonely. And also because, there might be information in my story that could be useful and helpful to somebody else. So.
Yeah, no, I really appreciate you doing this. And this is my first anonymous interview, so
I'm honored.
It's a little different. But I thank you, first of all, for getting me to do the topic, which we did with Chani Yondorf, and I'm going to post the link to that podcast so people don't have to scroll back and find it. And she was great, right?
She really was. I want to, if people want to learn about it, from a doctor's point of view, I would say definitely listen to it, because she really talked about it in a really comprehensive way that, to get it started. And if you're having those kind of symptoms, things that you could ask your gynecologist about. And I think that was a really great podcast. So,
she did a great job. And again, I have to thank you for getting me to do this.
Oh.
So yes, I love it when listeners give me ideas, especially when, I'm a pediatrician, so I tend to do more pediatrics and mental and behavioral health than anything else. So I can neglect topics, and that's why I'm just asking people to do it. So I'm really glad that you did. But you pointed out there's a difference between a doctor's viewpoint and, of course, the patient's viewpoint. So I would love if you would go back to the beginning of your particular journey with adenomyosis.
Oh, okay. Well, also I had adenomyosis and endometriosis. So, which I guess I'll explain, they often go together. So, so it started with, I really don't know, it's hard, they say that one of the main symptoms is, heavy periods, painful periods, that you think people say menstrual cramps are normal, but pain like that is not. And I can't say that it was really so terrible. There was a period of time where I had terrible menstrual pain that I couldn't, alleviate with Advil. And I remember that was on a Sunday, and I didn't know what to do with myself. And I couldn't wait till Monday morning when I could call the doctor. And he said, oh, okay, here, I'll prescribe prescription, naproxen, prescription Aleve. And it really made a difference. And then there were times where if, I don't know, my period started when I wasn't ready and I didn't have it on me, where I'd have to like really like white knuckle it till I could get it. But mostly I can't say that my periods were so painful. Pretty heavy though. But it was really pain just throughout the month, like just, not constant either, like up to a certain point. Like once things progressed, like there was always pain in the background, and then it would flare up. And in the beginning, it would be like every once in a while, every, I don't know, let's say 3-4 months, I'd get like this terrible pelvic pain where it would like, but I couldn't move. I mean, it was painful to walk, it was painful to sit. And the first time that it happened, I called my gynecologist and I said, I'm having this terrible pelvic pain, and, they would check me out. And he said, everything seems okay. We'll send you for an ultrasound. And the ultrasound showed cysts in my ovaries, and which I was told probably shouldn't be. They weren't big enough to be causing the pain, probably not the source of the pain, and nothing to really worry about, but we'll keep an eye on it, do a follow-up ultrasound in like 3 months. And this kept happening and happening, and I was getting like really frustrated. And I have to say also, because I know I'm not the only one who had this, my gynecologist at the time, I remember he once, at one of these times, and he said, okay, go get an ultrasound, and he gave me a prescription for an ultrasound, at a radiology place. And I was in his office, I think within that, like after the 3 months when I was supposed to go do the follow-up and for something else. And he said, oh, did you ever do that follow-up? And I said, no, I didn't get to it yet. I said, but like, can't you just do it? Because he had an ultrasound machine in his office. He's like, yeah, I could do it. It just makes my life easier if you would go there, which is a pretty obnoxious thing to say. And I know I'm not the only one who's got an attitude like that. And that went on for a while.
I'm stuck. I just want to interrupt you 1 second. I'm stuck on the fact that you're having pain that is clearly not normal. I just want to point out that is not normal amount of pain to have.
Yeah. Well, what would happen is that like I would feel the pain, like I would feel it starting up. And then, after the first 2 or 3 times that I had this, I stopped even going to the doctor, because I knew like, okay, this is a thing that happens. I probably have a cyst on my ovary. It'll feel really bad for about a week, and then it'll ease up, and, okay, maybe it'll happen again. So I did this like a few times, and then I would just leave it until every few times that it happened, I would say, okay, this is not normal. I mean, it doesn't seem normal to me. Let me call the doctor again this time. And, so I'd go through the same thing again, do the ultrasound, cysts on my ovaries, but shouldn't be a problem, but we'll follow up anyway. And then they would either be gone or be smaller, or, and they would say like, yeah, but you're okay. And
because they're not seeing what's going on, which is not uncommon for this particular disorder.
Right. But what like, when I look back on it, I think, and that gave me like a little bit of peace of mind, because I thought like, okay, if this is going on for so long and nothing new is showing up, I can, I don't really have to worry that there's something terribly wrong going on, and it's just pain, and I'll figure it out.
But wait, what do you mean by just pain? You said a week.
Right.
You said these episodes were lasting a week. I mean, were you able to function?
I was able to function because I pushed myself through it, because I didn't want to be, I mean, there were times when I really, really couldn't, when I was like, but that was like, not so much in the beginning. Like, this is like a 10-year journey that we're talking about. So in the beginning, it would be that I would, like maybe have one day where I had to, or 2 days where I like really could not do what I had to do. There were a couple of days where like I didn't go to the, I was planning to go to the gym and I didn't. There were times when I like wanted to go for a walk and I didn't. But you know what? You're saying this to me like, wait, that's not normal. And now when I look back on it, I can say that also. But when you're going through it, you really don't realize that. And even now looking back, I'm thinking, why did I power through for so long, like when it was so painful? But at that stage, it wasn't so painful. It was just painful. And,
but I'm interrupting. I'm sorry. I'm interrupting you because I purposely interrupted you for that, because I think that's something we often do as women.
Yes. for sure.
So I want to focus on that for just a second and let everybody hold space for that for just a minute, that our pain, we have to take it seriously, right?
Mm-hmm.
And not
Mm-hmm.
let anyone talk us out of that this is not normal.
Yeah.
Okay, I'm sorry.
No, thank you for doing that, because that's really something that I've only learned like recently when I look back on it, and I think, okay, that was crazy that I can't say I accepted it, but I just tried to ignore it as much as I could because I didn't know what else to do. And then I remember one day I'm in the car, the radio's on, and then a commercial comes on for, do you have a whole list of symptoms? I'm like, I have that symptom. I have that symptom. Pelvic pain, painful periods, heavy periods. Can't remember what, like a whole bunch of symptoms. Do you have these symptoms? I'm like, oh my God, yes, I have like pretty much all of them. Well, then you may be eligible to participate in a study, and then you may have endometriosis if you'd like to participate in a study. I'm like, and that's what I have, and and then I start Googling, and there's so much more information now, and even now, nobody really knows exactly what it is and what comes, what causes it, and I don't know. There was not a lot, and at that point, I had a new gynecologist who was a woman, by the way, and I remember saying to her, like, okay, I went to her, right? I was going as a new patient for just a checkup, and so she's taking my history and she says, ask me about any concerns or whatever. And I said, yes, actually, here's what's been going on for me. And I told her about the pain and the cysts. And I said, and I wonder if I have endometriosis. And she said, well, it's really hard to diagnose endometriosis. The only way to really diagnose it is with surgery. So you don't want to do that. I'm like, no, that sounds kind of crazy. Yeah, okay. So I guess I won't know. And she said, again, she sent me for more ultrasounds, which showed up cysts. And then she said, if you're really in pain, you can try birth control pills, because that's what I would give you if I knew that you had endometriosis anyway. And I think now is a good time for me to say that birth control pills is a treatment for endometriosis and adenomyosis. It's not a cure.
Right.
And it sometimes gets presented as a cure, and it's not. It
Right.
just, endometriosis and adenomyosis are driven by estrogen. So if you can, lessen the estrogen, then you can lessen the symptoms. And I do not like hormonal things. Every time I don't like the idea of it. And also, like, every time I've ever done it, I really don't like how I feel. So I said, no, I don't want to do it. But I don't even remember what I thought I would try. I said, okay, whatever, I'll, and I think she actually even said to me, well, if you've been dealing with it so long, then, and nothing terrible is happening, it can't be so bad or something. She was pretty dismissive. And and this is also a thing where, like, why, I don't know. Oh, I'm sorry, I'm getting ahead of myself, but I kept on going to her whenever I felt like I was having the pain for too long, because most of the time, like I said, I would just know that it was going to pass, and it was nothing. It was maybe cysts, maybe not, and they would go away. And I, at one point but like I said, every few flare-ups, I would just say, okay, maybe I should check this out. And I remember going to her once and telling her, yeah, so it's the pain again. And she looks at me and she goes, there's nothing wrong with you. Why do you keep coming in?
Oh my God.
Like that.
See, just because you have a female doctor. Okay.
Yeah. I really thought, like, okay, I'll get more sympathy from a female. I specifically looked for my gynecologist before was male, just because that was the way it worked out. And I liked him, but then he changed practices and whatever. It was time for me to find a new doctor. And I specifically said I would like a female doctor. And I couldn't believe that, and also every time I would say something about the pain, she would say, well, I told you, you could take the pills, but you don't want to. And I would tell her why I don't want to. And she's like, well, it's your choice, but that's what all my patients do that. And all my patients are happy with it. But if you don't want to, then it's up to you. And she would
Your
say,
fault.
yeah, like, so that's another thing. It's like, when we accept pain and we also accept being dismissed like that and being talked down to. And when I walked out of her office, out of that appointment, thinking like, okay, I'm done. I need a new doctor. But, finding a new doctor sometimes is it's very stressful. And I stuck with her for a while until, no, did I leave her then? I can't even remember. At some point, at some point she literally bullied me into taking the pills. And it took a good like 6 months till like my body even adjusted. Like I had like weird bleeding here and there from it. And every time I would call her, say like, is this normal? She said, yes, like that. There was just a lot of not feeling good about myself and feeling like, am I being a pain? Am I complaining too much? Just like a lot of, they call this medical gaslighting. And it just sounds so horrible, because if you're going to a doctor because you have pain or because you have something that you would like to get checked out, I mean, you should never be talked to like that, but especially if you're vulnerable about something like that. And
100%.
And it happens just all too often.
And it's not going to be better lately because the time pressure for doctors is such a problem, right? I mean, it takes time to listen more. And people can do it, though. I'm sure doctors are going to be listening saying, hey, I do this in my few minutes that I have. It can be done.
Even if she was limited in the amount of time she could spend with me, she could have been a little more empathetic. She didn't have to say, oh, why are you here? There's nothing wrong with it. She could have said it something like, I feel so bad. You're in pain and you're looking for answers and you keep coming back and I'm sorry, I can't help you, which is what other doctors said to me. She just was really obnoxious. And
sorry.
Thank you.
It's awful.
Yeah, because, and it's not like, oh, you're going for a checkup and your doctor's like a little bit annoying and annoyed and you're just like, okay, fine, whatever. Just, I want to make sure that I'm okay. I was going to her because I was not feeling well. And that was not what I needed. So, after being on the pill for a year, I just couldn't, yes, my symptoms did, it did alleviate my symptoms, but I just did not like how I felt in my body. Like I gained weight. I just was uncomfortable in other ways. And I said, you know what, I can't do this. If I know, now I have a better idea that maybe the pain is from endometriosis. So I know that that's not like a dangerous thing. It's just painful. If I, I'll deal with it. And I kept on just like saying, okay, I'll deal with it. And then I don't remember, that might have been the thing that sent me to find a new gynecologist, but at some point I had another gynecologist, also female, and she was really, really nice. She was really sympathetic. And when I told her that, I think I have endometriosis and these are my symptoms, and she at least was nice. And she said, yeah, it could be, but unfortunately, it's just really a confusing disease. It's really hard to diagnose. Let's try and treat your symptoms. And she also sent me for a whole bunch of ultrasounds all the time. And at one point, I remember she said, like, I want you to go to get an ultrasound in the hospital, radiology, and I want it this, I'm going to put in the prescription that I need this particular radiologist to read it because he's really good and we're going to figure this out. And again, it was, cysts on my ovaries, go get a follow-up. And meanwhile, my primary care doctor said, we're going to figure this out. She said at one point she thought, maybe it's not like a pelvic issue or a gynecological issue. Maybe it's like something structural or muscular. She sent me to a pain rehab doctor who sent me for a whole bunch of MRIs, which showed a labral tear in my hip. And most of my pain was on my left side, and it was a tear on my left hip. And so a labral tear is like a tear in the tissue that, because for anybody who doesn't know what that is, the hip is like a ball and socket kind of joint. So there needs to be some kind of membrane there to keep it, in between. So that's the labrum or labrium. I don't know. And she said, oh, that could be causing the pain because it's like there, it could be causing pain in that whole area, and sent me for PT, which was helpful for a lot of other things, but like that pain didn't go away. And at this point, like this is, probably over a period of 5 years, maybe more,
Wow.
where, the pain is getting worse, it's getting more constant. And, you know, I don't know how many times later, my primary care doctor said, no, we're really going to figure this out. You shouldn't be in pain. We need to figure it out. We need to know what to do. And she sent me for a CAT scan. And in the CAT scan, she said, like, I don't know, something looks weird. Like they're saying something about your bladder, but I don't understand it. It's not my specialty. Go see, or something about my kidneys. I don't even remember exactly what she said, but she said, I know this is not my specialty. I know I can't help you with this, but you should go talk to a urologist. So I'm trying to find a urologist that takes my insurance. Also, I thought I wanted somebody female. I wanted an appointment, closer than 6 months out. And it was really hard to find somebody. And while I'm doing all this research, trying to find somebody, I realized, this is like sort of a I think this is gynecological. There has to be a specialty called urogynecology. And I start typing it in. And I'm like,
right.
and it comes up. And it comes up. And there is, in fact, a specialty called urogynecology. And, also like nobody mentioned that to me. And so I found somebody. Oh, and in between all of this, I was also getting every GI test. Well, maybe not every GI test, but a lot of GI tests because, I had some GI symptoms, or it was just, sometimes the discomfort. I thought, okay, maybe it's some sort of GI issue. And, my GI was also like so devote, he sent me for everything. He was so nice. But he also would say, well, maybe it could be that. So check that out. Maybe he also couldn't give me anything definitive. And so, there were some people who were really trying to help me, but, so I found this urogynecologist. I asked, I don't remember who, I asked one of my doctors to recommend somebody, and they gave me a whole bunch of names. So from all the people who could see me soon, who took my insurance, who I liked what I saw in their bio, I found somebody and I got an appointment. And she said, she's, did an exam, and she said, does this hurt? Does this hurt? And I told her where it hurt. And she said, it looks like, that's your pelvic floor. Maybe it's your pelvic floor that's causing the pain. And we fixed that with PT, pelvic floor PT. And if that doesn't work, then come back to me and I'll give you some Botox, and we can do Botox injections in your pelvic floor and, help numb it. So I left her office thinking, oh my gosh, I have an answer. Like, I know what's wrong with me and I know what to do about it. And, and she also said, here is a, PSA thing. She wanted to do a cystoscopy, which is a camera in your bladder. She's like, she told me, we do it in the office. I give you local, numbing, and it's fine. That is the most painful test that I did. So I'm telling anybody, if your doctor wants you to have a cystoscopy, you need anesthesia for that. The whole thing takes 5 minutes, but it is so painful. So, maybe they won't give you anesthesia, or, that's not appropriate for that, but just know that it's not just like a procedure in the office. It really, really hurts. So, thank God my bladder was fine. And I was trying to find a pelvic floor physical therapist. And by accident, I was like, she said, oh, why don't you her practice was in the hospital. And she said, just go upstairs and you can make the appointment right away. I ended up on the wrong floor and made an appointment with somebody. It wasn't PT. It was like the rehab medicine, pelvic, gynecological pelvic rehab medicine. And I made an appointment with this doctor, and which I thought was strange because they said like, oh, okay, doctor, whatever, we'll see you next week. And we made an appointment. And I thought, a doctor, that's interesting.
For PT,
But,
right?
right. Because but I thought, okay, I guess this is what they do for pelvic PT. And then, I don't know, at some point before my appointment, they called and canceled. They said she couldn't make it, or she's sick or something. And they said, but we can reschedule with doctor who, a different doctor. So I said, okay, fine. So I went to that doctor, and that's not where I was supposed to be, but it was good that I ended up there because she was also so helpful. So she said, yes, your pelvic floor is tight. Pelvic floor dysfunction can cause a lot of pain. You should definitely do PT. We can do injections, trigger point injections, but, let's start with the PT first, and, we'll see what we need to do. And she was also really nice. And then, I find at some point we realized, like, wait, you're not going to do, she, that she wasn't the physical therapist. So she gave me another referral, and I called there, and they said, oh, there's a 4-month wait list. Another thing for people to know is that it's really important to have a very good pelvic floor physical therapist. It's important that that is their specialty. It is a very specialized thing, and it's hard. It's not always easy to find somebody good that will take insurance. But I thought, no, I have insurance. I want them to pay for it. So I was doing in this practice, and so there was a long wait. So when I finally got in, also, that PT was so nice, and she was so validating. And and she said, yeah, here's what we're going to do. And she said, yeah, I can help you with this. And she gave me stretches and exercises, and, she did like some manual things. And I thought, okay. And, and I told her, when I gave her my whole history, I said, yeah, so I think I have endometriosis. That was how I started my new patient visit with so many people. So I think I have endometriosis, and here are my symptoms. And she said, yeah, it sounds like you could. And then I don't know if it, like, my second or third visit, she hands me a piece of paper. She said, here, we have a new women's health department here, women pelvic. I don't remember what she said, but we have a new doctor here in the women's health department who specializes in endometriosis. You should go see her. So I said, oh, wow. I made it. I don't know how I was able to get an appointment so quickly with her, because now it would take, I don't know. It's so hard to get appointment. You can make appointments with specialists, or even just, in primary care doctors, and it could sometimes take 3 months or longer.
Right, it's because she was new. That's why.
Yeah. That's probably why. So I met her, and I have to say, I did not love her, which really upset me. I felt like she was a little bit cold. But she listened to me, and then she said, and here's the thing. Everybody would ask me, is there a pattern to your pain? Do you notice it? Like, what time in your cycle does it hurt most? Or when do you, and there was no pattern. There was no pattern to my pain, which made me feel like I was giving the wrong answer most of the time. And I know that was on me, but still, like, you get to this point where you just like start doubting yourself.
Right.
So she said, endometriosis, and I don't even know if this is true, but she said endometriosis is more, in tune with your cycle. It sounds like, from your symptoms, it sounds like you have adenomyosis. And I had never heard that word before. She said, but the good thing about adenomyosis is that we can see it in imaging. So she sent me for an MRI, which did, in fact, find the adenomyosis.
I just want to interrupt you for just a second, because I researched this before our talk.
Yeah.
And that there's a lot of, there's more ability to find it on sonogram. And even though MRI is more accurate, it's more sensitive and specific than sonogram. Sonograms are cheaper and easier to get, and they can often be a way to diagnose it. I'm just throwing it out there.
Yeah. And often insurance, because I had this recently, insurance will have you do an ultrasound before they'll authorize an MRI or a CAT scan.
Right.
So, so she sent, yeah, right. So, but she sent me for an MRI. This was like, I don't know, maybe 2.5 years ago. I really think in the last 2.5 years, things really have progressed because I've since had ultrasounds where they saw it, and I didn't at that point, and I'd had ultrasound like, I don't know, close to that time. I mean, maybe they didn't know what they were, maybe they need to know what they're looking.
They have to know what they're looking for. It's operator dependent, et cetera.
Yeah, right. So, but still, I would think if a patient comes with pelvic pain, you're going to look for adenomyosis. I don't know why.
Well, you'd have to know to look for.
Right.
It's still poorly. We're making progress, but it's not on the top of people's radar, doctors' radar.
Yeah. Yeah, it's really yeah, but the good thing is that there is progress. I've seen the difference. And I'll say that during this time I found a chat from this page on Instagram where she said if this is not my thing, but women are asking me about endometriosis, somebody wants to start a chat, let me know if you want to be on this chat, message me, which I did. And I found this group, and it was so great. It really was. Everybody was telling there were, I don't even know how many of us there were in the beginning. There were like maybe 6 or 7 of us. And some people had diagnoses, some people hadn't yet, but it was just, people had information. We could share information. We could give each other empathy. It was real. And I was learning from it, but I hadn't heard of adenomyosis then.
I just want to stop you just a minute. This is a WhatsApp support group, right?
Yeah.
How many people are in it now?
How many people are in it now? Maybe 10 or fewer.
Okay, so it's not a huge group.
No,
because there is no other support group for people with endo or adeno, as far as you know, correct?
As far as I know, no.
So
no.
I think it would be fair to say at this point that if people want to, they could reach out to me at health, HEALTH at JOWMA.org, and I could connect to the person who's in charge, who's that admin of that WhatsApp group. So people can join that if they hear this, because I want to offer something, and there really is nothing else.
Yeah, it's really, I mean, there might be, and I just don't know, but yeah, I could, people should ask you, and you could direct them, I guess, because it really is helpful.
Right. I'm a huge believer in support groups. Yeah.
It's great to have validation. It's great to have support. There's, an exchange of information there, and it's just so, especially in when you're dealing with something that so few people understand or know about, and people have, and here's another thing that I went through when I joined this group is that some of these women had really terrible situations. And at some point I thought, okay, maybe I don't belong here. Why am I feeling sorry for myself? Why am I, I'm not, what I'm going through is nothing compared to what other people are going through. And that's not fair to do that, because my suffering was my suffering,
Right. It's kind of a form of imposter syndrome.
Yeah. in a twisted way.
Right. I'm not suffering enough.
Yeah. Yeah. Like, oh, my endo isn't bad enough. I don't know if I have it. So she said, I don't know why, who gave me I spoke to somebody else before I spoke to the doctor, when they told, maybe it was in my app, I don't remember. And this person said to me, like, yeah, and so they saw the adenomyosis, you have, mild adenomyosis. I'm like, oh my God, really? No, I didn't know. That was why I did this test. And I felt like
back to the MRI results.
The MRI, yeah. And so then I had to have, I had a follow-up appointment with the doctor, and she said, okay, she explained to me what it was. And it's, when cells that are like the lining of the uterus grow into the muscle of the uterus. And she said, there actually is a way to cure that. Hysterectomy will take out your uterus and it will take out the disease, and that's that. And she said, and I must have really like looked surprised. She said, but we keep your ovaries. So you'll still have the estrogen, you'll still have hormones that, you won't go into menopause. And she said, oh, and very, the thinking is that when women go into menopause, all of these symptoms stop. The endo and the adeno stop because they're not being fed estrogen so much. So she said, you could wait until menopause, you could do a hysterectomy, you can have a hormonal IUD, you could, there was some nerve thing that she could try, I think like some sort of nerve ablation thing. I don't even remember because when she told it to me, I said, I'm not doing that. And she also said, it's not always effective. So I sort of dismissed it and I don't even really remember what it was. But I just felt so validated, so like vindicated.
Finally, right? How many years was this?
Probably about 7 years at that point.
Wow.
Yeah. Yeah. And it, like I said, it had been steadily getting more painful and the flare-ups more often. So but all those options that she gave me, none of that sounded attractive to me. None of that sounded like anything I wanted to do. So I was still a little bit confused, but I felt like, okay, I had someone, finally knew what was wrong with me. I had someone who, talked to somebody who knew what she was talking about. And I felt like if I know what it's from, I can handle the pain. Let me find ways to manage the pain. So I continued with the PT. My PT was pretty, into holistic kind of things. So she recommended craniosacral therapy and acupuncture. And at some point I found like an integrative medicine doctor, and I thought, I'll try to modify my diet, be anti-inflammatory. And the PT was really good. Like there were times when I would go into PT in a lot of pain and she would do whatever she did. And I would walk out of walk out of there like a normal person walking, but it never, I'd go, I think once a week, and it never really lasted for more than a few days. And then I would have these flare-ups, and then it was time for me to go to my regular gynecologist for a checkup. And I told her, guess what? I have a diagnosis. I know now that I have adenomyosis. And she was really nice. She was the one who kept on saying, okay, we're going to figure it out. We're going to, she was just so nice to me. And she says, well, adenomyosis is a pretty murky diagnosis. We don't know what to do with that. And I like, what? But it's like, I think it's so specific. What do you mean? I remember she used the word murky, and I still don't even know what she meant by that.
Because it's not being directly diagnosed until you take the uterus out and look at it under a microscope.
Right. Yeah. So I don't know. Like, I didn't know what to make of that. And I just thought, okay, but at least I know what it is and I'm trying to manage it. And, if I really can't handle it, I know that there's always the hormonal treatment if I want to. At that point, I'm like, no, I'm not doing a hysterectomy. But I'll keep doing the pelvic PT. I'll try acupuncture. Oh no, I hadn't tried acupuncture yet. I was doing craniosacral therapy and PT, and the craniosacral therapy did not help for my pain, but it just kind of made me a little more zen. So I was able to handle the pain more, except for when it was a flare up. It was, the flare ups were really hard. And trying to think, no, that was okay. So then the next big thing that happened was that I decided I wanted to do the diagnostic laparoscopy. I said, I need some answers. I know that I have adenomyosis and I'm not ready to take out my uterus, but I would like to check inside and see if I have endometriosis. Because if I have endometriosis, then that can be taken out and maybe that will give me some relief. So oh my gosh, was so hard. I remember I had a telehealth appointment with this doctor, the one who diagnosed it. And she said, yeah, that sounds reasonable. I said, my pain is getting worse. My flare-ups are becoming more often. I was having GI symptoms, like bladder symptoms, so thankfully I had a urogynecologist at that point, because I was going there pretty often to thinking I had a UTI. And at some point, she said, like, yeah, you have to, that's not the problem.
So I'm sorry,
And
just to clarify, you mean that you're having GI and urinary symptoms is probably more from the endometriosis than the adenomyosis? Would that be
well,
correct?
from either.
Mm-hmm.
And what the endometriosis doctor said to me, and now I know she wasn't really an endometriosis doctor. She was just a gynecologist who specialized in minimally invasive surgery, who does endometriosis surgery. But that's not her specialty, which I have learned is what you need when you're going to do endometriosis surgery. You need an endometriosis surgeon, like that is their specialty. So I had this appointment with her, and she said, yeah, it makes sense that you would want to know. But she also said that, the uterus, the bowel, and the bladder all share nerves. So if, even if there is no endo on my bowel or my bladder, it makes sense that it would hurt, because my uterus and also the uterus touch, all the organs touch each other.
Right.
But she said, yeah, that makes sense that that you want to know. So, somebody in my office will contact you, we'll schedule surgery. And nobody was contacting me. And like about 2 weeks later, I think I called her office, and then, I don't know, we were going back and forth until finally somebody from her office called me and said, oh, she wants to schedule a telehealth appointment with you. I said, huh? Yeah, to discuss surgery. I'm like, huh? So we had this telehealth appointment, and she said, oh my gosh. She said, I don't know what happened. I know we had an appointment a few weeks ago, but I didn't save my notes, and I don't know what we discussed.
What?
Can you tell me? Yeah. So, yeah. Oh my God. And, and there was a copay for this too on mine. But the worst part of it was that I told her what we discussed and what we decided. And she said, yeah, I don't know if that's really such a good idea. I don't know, maybe for someone your age, I'm going to have a hard time making a case for this. I don't know. Why don't you just come in? I'll give you a hormonal IUD. Like, she just did a total flip.
Right. To be fair, though, because again, I mean, this is your end of the story, right? I mean, to be fair, she may have been thinking this is not going to be beneficial, and why should she go through this? No?
That probably is what she was thinking. I don't know why.
She could have said it more clearly, right?
She just made it sound like she had attitude again. Like, why are you wasting my time? I could very easily, you could come in, and in 10 minutes, I could give you an IUD, and you can walk out of there with the hormones directly in your uterus, and you'll be fine. Why do we have to do that? Like, that was kind of like her attitude. And I remember like hanging from that call thinking, like, oh my God, like I'm losing my mind. Like, I must be crazy. Anyway, I had the surgery, and she did not, she took a bunch of biopsies. I like for, diagnostic laparoscopy, I wasn't going to do a hysterectomy. I figured I'll deal with the adenomyosis. I want to know if I have endometriosis, and if I have endometriosis, I want it out. So we did the laparoscopy and hysteroscopy, and with the DNC, and she, the biopsies showed no endo, were negative for endo. And I don't know. I felt like, okay, at least I know, but like, I don't know. It just sounded weird to me, because I don't know, from what I learned is that, most of the time, if a woman has adenomyosis, there's endo there too. Not necessarily the other way around, but if there's, not everybody with endo also has adeno, but if you have adeno, most likely there's endo too. And I just thought, okay, fine, now I know, and now I have to figure out what to do with this information. I know what to do, and I'm gonna continue trying to manage my pain. And that was really almost like a full-time job at that point. also because I was, just learning about it,
Right.
learning so much, learning so many things. And honestly, I don't know what I would have done without that group, my WhatsApp group, because, everybody was validating, everybody was supportive, also learning information. And, and at some point also I think I had stopped with it. Oh, no. I was still doing PT. think I had a different physical therapist at that point in the same practice, but she had left. There was someone else. And so she was also, she said, she's actually one of the people who said to me, I think you probably have endo also, because most women who have adeno have endo too. And after that surgery, for a while, I felt pretty good. And I thought, okay, maybe the DNC, because there was some inflammation in my endometrium. So I thought, okay, maybe that was like, making it hurt more. And she cleared that up. And for a few months, I was really feeling good. And I was happy I did it. And now I felt like I had answers. And then, I don't know, it just started to hurt again. And I did a whole bunch of other things. I tried lidocaine injections in my pelvic floor, kept up with pelvic floor therapy, craniosacral therapy. I started acupuncture, and all those holistic things really just kind of helped calm me down. They didn't really do anything with the pain, but they calmed me down. So I would recommend them. I would say that this is a really difficult thing to go to, and if anybody wants some, I wouldn't say pain relief, but just like some sort of like, I don't even know what the word is. I think it's helpful just to help you deal with it.
Mm.
I did whatever. Yeah, I started yoga. I felt like that was helpful to me, not for the pain, but it helped me see all the strong things that my body could do. You have to figure out what's going to do it for you.
Mm.
That's what I found. That's what I learned. That's what I want to pass on. And my PT kept on saying, I would go back to her in pain. She would fix me up a little bit, give me some relief, and I would be in pain. And she kept telling me, there's this doctor, he does this, which I knew about him. He's an endometriosis surgeon, and he does these free phone consult, video telehealth consultations. You send him all your, imaging and all your notes, and he'll tell you what to do. And I just was really not, I wanted to do it, but I thought, I have to find everything. I know what's wrong with me. And then at some point I just I did it. And I met with him, and he said, yeah, looks like, oh no, sorry. Before that, somebody on the group mentioned how she had nerve blocks that really helped her. And she recommended the doctor she went to. And I got an appointment with her. And I also Googled her, and I found, she has a podcast. So I was listening to her podcast, and she did an episode with an endometriosis surgeon. And I said, and she's in NYU. And I said, okay, great. Going to make an appointment with her. And before I got to see her, I had to see her NP who ordered the imaging. So first, she wanted me to get an MRI, but my insurance made me do an ultrasound before that. And I literally had PTSD because I had been in all the practices that I've been to, we're in different hospitals, and I had not been in that place in NYU for an ultrasound in years. And it all came, I remember being there crying, thinking, oh my gosh, all these years that I did ultrasounds in this room.
Oh, wow.
And I'm back here again. And it was very, very painful. Vaginal ultrasound is very painful when you have, things that cause that kind of pain poking around my uterus. And the ultrasound, they were able to see the adenomyosis, and also areas where they suspected there might be endo.
Yeah.
And
it's not common to miss that on the hysteroscopy, though.
Oh, the hysteroscopy is not going to show endo anyway. Because
no, the endometriosis I'm back to. I'm sorry. I'm stuck on the endometriosis.
Yeah, well, I knew when I had the hysteroscopy, I knew about the endometriosis anyway, the adenomyosis.
Right.
You
But you
know,
were told there was no endo.
I was told there was no endo. But this ultrasound showed endo, and then I followed up with the MRI, which showed endo, adeno. I mean, suspected, because you can't definitively diagnose it from the imaging. And this surgeon wouldn't see me because she didn't see women my age. I was above her age cap, which I thought was really obnoxious also. And I had to see her associate. And I thought, okay, and the NP says, no, I work for him too. And he's really good. And she handpicked him. So I thought, okay, fine, I'll go see him. And he was so nice. And he spent so much time talking to us. But I left that office and I thought, you know what? He had me looking at his computer, and I thought he was going to show me things on my own imaging. And he was pulling up pictures from Google to show me what adenomyosis was. I'm like, I know what adenomyosis is. I would like to see my own adenomyosis if you think it would be helpful. And he said, and if we do a history, if as the definitive cure for this is a hysterectomy. And of course, and I said, yeah, but you would leave my ovaries, right? And he said, no, I would take your ovaries out. That's what we do now, because endo is fed by estrogen, and your ovaries will keep producing estrogen, and so we have to take them out, or the endo will come back. I don't know, that just didn't sit right with me, because I was told, like, even women in menopause who have hysterectomies, they leave their ovaries because there's always a little bit of estrogen that's good for bone health, for heart health, just keeping your hormones steady if you have it. They're doing what it's supposed. There's a reason that they're there, unless there's a reason to take them out. But adenomyosis is not a reason to take out ovaries. And I will also say that a lot of people think that a hysterectomy is a cure for endometriosis, and it is not. So if anybody does not have adenomyosis, they have endometriosis, and they were told to have a hysterectomy, that is wrong. That is absolutely wrong. So that's something that people should know. And that also, there's no reason to take out ovaries unless there's a reason to take out ovaries. So I left that office thinking, like, I just don't know what to do. And I decided to have that telehealth appointment with the endometriosis, the other one who does, and he doesn't take insurance. It just seemed like a big deal, but he'll do this consult for free. So I had the phone appointment with him, and he said, yeah, I see that, it looks like, the endo is there and the adeno is there. And, and he said, I could really tell a lot more if you came to my office and I could do an ultrasound. And I don't know. I just said, you know what, I came, like, I've been doing all this time. I'm just going to go see him, which I did. And he was so nice, which also, like, it's sad that we have, when a doctor is nice to us, it's sad that that stands out, He was just so, in his whole office was just like so nice and empathetic and kind. And
it makes a huge difference.
It really does. It really does. Because, like I said, you're going to these people, these specialists, because you have a situation that is not okay. And, that's what you need. So
for sure. I mean, it's basic, but you have to say it, because you didn't get it a lot of the time.
Yeah. There's a book, we kind of discussed this book, Beating Endo, which is really, I recommend it for people who have endo or adeno, and you want to learn. Well, there's not so much about adeno, but a lot of the things apply. By Iris Orbuch and Amy Stern. It's written by, I think, Amy Stern. I think that's her lot.
Amy Stein, yeah.
Amy Stein, right? Okay. She's a PT, a pelvic floor PT, and Dr. Iris Orbuch is she's an endometriosis surgeon. So
who
they wrote,
herself has endometriosis.
Yeah, she just recently, if you on her Instagram, she, like, I don't know, 2 weeks ago, just said, like, oh, hey, by the way, I have endometriosis. Here's my story, which was like, what? Did I miss something?
She also said that she got diagnosed because of her daughter, because she said, hey, this is genetic.
Yeah, it does tend to run in families, they say. although I don't know any other women in my family who have it.
Mhm.
But, and she said it took her 17 years to get diagnosed.
And she's a doctor.
And she's a doctor.
A
and
specialist in the field.
Yeah. And she said that like, she never, like, she always thought that there were problems, but she never, she also like, oh yeah, okay, whatever. It's fine. It's fine. Like we said in the beginning, like, no, it's not fine. And she just didn't look further into it until her daughter was sick. So this book it's full of a lot of really good information. There's a lot in there. She talks a lot about preparing your body, giving your body the best chance for recovery. She's a surgeon, so she talks about what to do to prepare, to take care of it, and how to prepare for surgery, and how to get the best chances for best outcome of surgery and the best recovery. And she talks about taking care of your mind and your body, with diet, exercise, meditation, alleviating stress, which are really all good things, but a lot of it is hard to do on a regular basis. So I think, reading that book should be done with, knowing what you can and can't do, like just, which is part of the whole thing, is to know yourself.
Right. It's an idea book, not a rule book.
Right. But pelvic floor PT, I think that is essential.
Mm-hmm.
I do.
Mm-hmm.
I would say that.
I'm going to have to link to our talk with, my talk with the pelvic floor PT as well. Yeah. It's really important. She talks a lot about diet being anti-inflammatory. I don't know how evidence-based this is. Yes, there's inflammation that leads to the pain, but I'm not really sure that all the things that she talks about, like I heard her talk on a podcast, and she was talking about how it's important to go gluten-free and bio-organic. And these are the kind of things that made me, as an autism mom, crazy. It's the same kind of thing. And I think you have to, like you said, pick and choose what works for you, and not let anybody guilt you into doing stuff, right? Whether it's a doctor telling you what you can and can't do, all right, or dismissing or not dismissing, or an alternative approach, right? Take from what works for you.
Right. I think it's good for like learning, learn about it. See, like, oh, okay, I didn't know that. And then, do your own research or try things out for yourself. But also know that it's so unrealistic to follow everything there, to the key. Definitely there's a benefit to calming your body, like, meditation, because I found myself that my pain would flare up more when I was stressed, or, there was stuff going on, and it would hurt a lot more. So the idea behind meditation and yoga is that it puts your body in a more, that the state of your body, normally is more at peace. And if you ever feel stressed, you can more easily and more quickly get into that state. So, I think that's great for everybody. And especially if you have like, a chronic pain condition, it that can only help. Exercise, of course, is always good for that. And eating well, that's also important too, but like I don't think it's realistic to only eat organic. I don't think it's realistic. I don't think for everybody it's necessarily even beneficial to go gluten-free. I tried it, didn't help me.
Right. If it doesn't work for you, then it doesn't work. End of story. Different people are different. Right.
So it's important to know that. But she said what she does with her patients is when they're going to sleep on the operating table, she holds their hand and says, think of a happy memory or your happy place. I can't remember exactly which. And I read that, I'm like, wow. So it is important to have somebody who cares and, wants you to do well. Anyway, so I met with that endometriosis surgeon and had such a great appointment with him. And he gave me all the information and everything about my situation. And he said, and ultimately it's up to you. He said, you what it came down to was a quality of life decision, really. And, there were people on the chat who had, and he said, if you decide to have a hysterectomy, we will keep your ovaries because you need your ovaries and your ovaries are not a problem. One of my ovaries may have had endo on it. He said, we'll see what we can do about it, but for sure the other ovary stays. And, I really thought about it. I really didn't know what to do. I was at that point in like probably almost constant pain. And, on the chat, there were a couple of women who had had hysterectomies. And, when we would talk about it, I said something like, earlier when I said, that sounds really drastic to me. I don't know if I'm ready to do that. They all said, when it's time for you to do a hysterectomy, you will know. You'll just, they said, we didn't make this decision right away, but it came to a point where we just said, yeah, it has to come out. And, they feel the improvement since then. So, I had individual conversations with them. I did my research on that, and it got to a point where it was just really affecting me so badly. And I said, okay, I'm going to do the surgery. I'm just going to do it. And I scheduled the surgery. And then I said, okay, I have time. It was, more than a month away. I said, I have time to chicken out of it. I have time to do some more research. And like up until the day of, and there were things where, right from then I knew that this first surgeon who did my first surgery was not an endometriosis specialist. I could tell the difference right away. An important thing for people to know is that surgery for endo needs to be excision surgery. If you are looking into this and you're looking for a surgeon, you need to make sure that the surgeon does excision surgery, where they actually cut out the endo from the bottom and take it out of your body. The other procedure that they do is ablation, where they kind of just, burn it off on the surface, and it I think it always grows back. And, different people have different, that's probably more like an insurance thing. And, also it's important to know that the surgeon that you go to is an endometriosis specialist, not a gynecologist, gynecological surgeon who has experience with endo. It's not the same thing. It's just not. And I learned that myself because I had the surgery and the biopsies showed endo. And
so this is the endo surgery that you're having, not the hysterectomy.
No, well, the second surgery, which was endo, excision, and hysterectomy.
Okay, it had the same time. Okay.
It had the same time. And, I just, I don't know. It's a crazy thing to be happy that, like you have this disease, but I just felt so validated. I can't say happy. That's too strong of a word, but, just being handed off, by different doctors or dismissed or blown off was just such a horrible experience. And knowing, learning along the way is so important. And, when it was time for me to do this surgery, I knew it was time to do the surgery. I'm looking, I wrote a note in my phone when we decided to do this, and I have like this whole list of things, and I tried to put it in chronological order, and I'm like, okay, it would get this maybe is boring anyway, but there was just so much there that I'm like, oh my God, like I went through all of that.
Yeah, it's really an odyssey.
Yeah, it was an odyssey. It really was. And I hope, I'm at the end of it. And it just, I don't know. I don't know why it has to be so hard to find people who know what they're doing or who will listen to you. Even my primary care doctor, who really didn't know what was wrong with me and she didn't know how to help me, just knowing that she cared to help me find out was worth so much.
Right.
And even the gynecologist who didn't know how to help me but cared and was empathetic, also that helped so much. Ultimately it was, also I'm telling this story because it was just a string of events and string of some, accidents even that led me to the people that ultimately led me to the people that led me to find the right people. And, sometimes you have to go through it that way.
Take a shit.
Yeah.
Right. It sounds like that. That's the same kind of story. So how long ago was the surgery?
About 2 months ago. And I have to say, I feel better. I do. I mean,
Thank God.
thank God. I mean, I still have a little pain.
Mhm.
They say it's a good like 6 months for like a full recovery.
No, it's major, major surgery.
Yeah. Yeah. But I'm happy I did it. I really am. I was really, really nervous. And even, the day of the surgery, I remember talking to the surgeon and saying, like, okay, well, if you find endo, then can you just take out the endo and leave my uterus? And they said, we want to give you the best outcome. And that's not going to be that. But,
But you knew you had adeno. You knew you had significant adeno. That was the main part of your problem, right?
the main part of my problem was probably the adeno, but there was also endo.
Right. No, I know.
And that's why I'm thinking now, so what if with the originals, the surgeon who diagnosed the adeno, I'm thinking like, okay, so what if when she had said to me, okay, here's what we do, and we can do a hysterectomy, and she said, the only function of the uterus is to grow a baby. So if you're not having babies anymore, you really don't need your uterus. Like there's no hormone function, there's nothing that you need your uterus for other than that. Which was reassuring because it's not like, removing like a kidney or something that, you need. But I'm thinking now, what if I had said, okay, fine, you know what? I'm finished having kids. Let's take it out and I'll feel better. She would have left all the endo in there.
Right.
And that really scares me when I think about it. So, I guess it was good that I wasn't ready then. I don't know how she missed the endo. That was
a small percent can be missed on hysteroscopy.
Like, no. This was a laparoscopic surgery that she missed it.
Oh, and she was looking at it's not just hysteroscopy.
Yeah, no, she did hysteroscopy because I don't know, there was like inflammation in my endometrium, but the main surgery was the laparoscopy, to look for endo, and she didn't see it.
But I still think that there's going to be a small percent that are missed.
I think that by skilled,
it's not 100%.
Nothing is 100%,
right.
But I think that if this is not your specialty that you do all day, every day, you're not necessarily knowing what to look for or where to look or how to look for it.
Right. Which you're not confident that she just could have seen it if she knew better.
Yeah. Sometimes there are very small lesions and you don't see them. I know that endometriosis lesions look different sometimes, like different ones look different. So you might think, oh, that's not a lesion, that's not endo, let's just leave that. I've learned that, you have to move the organs around because they could be, it could be on the other side of the organ that you're not looking at. I also know that what I learned is that you need a team. You need an endometriosis surgeon who has a team. I mean, I was lucky. I didn't have endo on my bowel, but many women do. And then they need a bowel surgeon to be there for that too. Sometimes. And that a good endosurgeon does the surgery with a team. She was on her own.
You knew the difference. You knew the difference the second time around. That's the bottom line.
I knew that, you know what? And here's another sad thing is that I did not love her. I mentioned that the first time I met her, I thought she was cold. And then all the times that I met with her between then and the surgery, she was hot or cold. There were times where she was so nice and sweet and caring. And then other times where she was cold and dismissive. And I didn't feel good about her, but I said, no, I know that she's, she has good reviews. I know that people recommended her. The hospital hired her to head this department. I know that she's, I know that she's skilled. I don't have to like her. It's sad, but I'll she takes my insurance. I was able to schedule surgery pretty quickly. And like now that I know more than what I know now, I think like, and there were women on my group who said, yeah, she doesn't sound so good. Are you sure she's a specialist? Like, I don't mean to doubt you, if you trust her, then good, you trust her. But you need to know that she's a specialist. You need to know that she does this. Do you feel confident in that? And, again, being supportive, apologizing, not wanting to, make me feel bad or question it or doubt it. But she said, like, I want, this friend, she said, I want you to have the best because you need to do this right. Are you sure? And I remember when I spoke to her afterwards, talking about, asking about her experience with her hysterectomy, she said, I really didn't have a good feeling about that surgeon.
Which one are you talking about now?
The first one.
Oh, okay, the first one.
Mm-hmm.
The one who missed the
one who missed the endo.
Right.
Mm-hmm.
Right. And it boils down to, listening to your gut.
It boils
Right?
down to listening to your gut, although at a certain point, sometimes you're just wrong, which was after that surgery that didn't show the endo. I thought, okay, I know I have adeno. I guess that's the reason for my pain. And I know I'll just have to, I guess I was wrong. I guess I was a little bit obsessed with this endo idea. I don't know.
It's hard to trust yourself over all those specialists and all those years.
Right. So, my message is, yes, trust yourself, but also find people that work with people that you trust. If you don't feel good about a doctor, you don't have to stay with them and you can find somebody else.
That's what I meant by trust your gut. I meant trust your gut, that when you're with someone and you're like, I'm not connecting. They're hot, they're cold, they're not listening to me, they're dismissing me or whatever. Trust yourself. It's easy to say when you don't have a lot of choices. It's a different story.
Well, and that's the sad thing, is that there aren't a lot of choices. And when you go through like an Odyssey like this, you really feel hopeless, and you find somebody who kind of knows what they're talking about, or does know what they're talking about, but is not giving you everything that you need. You say, okay, it's okay. I'll make do.
You downscale. That's called downscaling.
Yeah. Yeah. And sometimes you have to, because, there are some excellent surgeons who just don't have, or excellent doctors who don't have, good bedside manner. It happens. It's sad, and it shouldn't be that way, but it happens.
Well, they might not have good bedside manner. They might be an excellent surgeon who knows exactly what they're doing, and I'll pick that over bedside manner when it comes to a surgeon. But not if they not only don't have the bedside manner, but they don't have adequate expertise, right?
Yeah.
So that's
I don't know. The doctor, the surgeon who did, my, most recent surgery, when I mentioned this doctor to him, he said, oh yeah, we know her. She's good. But I think at that point, she probably wasn't so experienced. And I think that's what it was.
Right.
But also that's not her specialty.
Right.
She does it, but it's not her specialty. So, you can follow all of these pages on Instagram, and there's a Facebook group called Nancy's Nook where I think it started with this woman. She had endo and she couldn't find care, and so she started this Facebook group with give out resources, and they vet certain doctors. I'm not sure exactly. I just felt like it would be too much of a rabbit hole for me, so I never looked at it. But women get so much information from it, and so that's a good resource too. And for networking.
Right. I mean, I think it could be helpful to ask other people who've been through it. Who did you go to? What were your experiences? Rather than just read reviews on Google.
Yeah. No. This is like Nancy's Nook is a known. It's a known. Page.
No, I'm saying that's good. That's good, as opposed to you just going on health grades or whatever.
Yeah.
Because other people will say, hey, this is the top doctor, or if you can get this one, they'll give you their own experiences, not just some random reviews on these websites.
Yes. And they, and most, so on this, but what they will say is make sure that they do excision surgery, not ablation, and make sure that this is their specialty. Not just like, oh yeah, they do surgery and they also do endometriosis, so like I said, there are pages on Instagram, women who became activists, and also doctors who do this. And that is really the biggest message, is that it has to be their specialty, because it's such a specific disease that it really needs to, it needs attention that way.
Right. And you are your own best advocate. and have trust in yourself, right?
Mm-hmm. Yeah.
Those are good take-home messages too.
Yeah. Yeah. If you're not, and pain is not okay,
Right.
and
that struck me from the very beginning of your story.
yeah.
Right. But if a doctor is telling you, oh, everything's fine, this is normal, right, you can not necessarily trust yourself. You might think, well, I should suck it up and, like you said, white knuckle it.
Yeah. And also, I think it's important to not do anything until you're ready, because I wasn't ready to do that surgery right away. I wasn't ready to do any surgery right away.
Right.
And then I thought, okay, I can handle a surgery where, we can see if I have endo and take out the endo, but I'd like to keep all my organs. And I don't regret it that I did it that way.
Mm-hmm.
In fact, I think, obviously everything works out the way it's supposed to work out, but, I had to get to the point where I was ready to do it. And it also taught me that, it led me to the right place ultimately. And yeah, I don't know. It's a crazy thing. It's just a crazy thing that, there's this disease that people don't know about and don't know how to get help for it and don't know how to, it's really hard to find support for it. And it's just, my stories of the doctors who were dismissive and condescending, I'm not the only one.
Right.
Every woman has had that, and every one of us has had countless tests. And when there were so many things, we're like, oh, I have a labral tear, great, now I know what it is. All of us had like, okay, now we know what it is, but then that's not, and and you treat that thing and it doesn't
right,
get better.
Yeah.
And then you feel like you're starting all over again, which is very discouraging.
Right. And also, like you said to me when we were talking before about how you can have GI symptoms, you can have urological symptoms, you can go to that specialist, and they're just looking at that one organ.
Yeah. Yeah. So that's why, in the book Beating Endo, she says, it would be so great for all specialists, like especially GI specialists, to know about endo, because if you have a patient, you have a female patient who has GI symptoms that check out, every test checks out, then, think it could be something else. And, you should know about endo because that's something to check out for it.
And it's common.
It really is. I mean, even when I was like going into the OR, talking to the OR nurse, and she's like, "Oh, I'll probably be I'll probably be here in a few years. I have endo too."
Right. No, it's supposed to be, I think, up to 1 in 10 women.
Yeah, that's what they say.
So that's really common. That's 10%. Up to 10%. That's common.
And they also say it takes like, I think 8 to 10 years, 8 to 12 years, something like that, to get a diagnosis.
Right. Right. And for adeno as well. It's so frustrating. It's so frustrating. But I think that as more and more endo warriors, they call them endo warriors, are out there, and as more and more people are out there, making noise and talking about it, and you're doing your part, right? I mean, this is so helpful. Like in the frum world, there really is so little out there. So I think it's really helpful to get it, from a frum woman to other frum woman is really, really valuable.
Yeah, I was talking to, a friend in this group, and she said she thinks CALA teachers should be told about this. This should be part of CALA teacher training also.
It's interesting you say that, though, because when I spoke with, I think it was with Dr. Yondorf, I was talking about, could it be more preventative? And I'm not sure, you have the problem of being too proactive and just scaring people, right? I think that doctors should be aware of it. I don't know if every person has to be aware of it before they have any symptoms of it. No?
Well, yeah. I mean, you can't be preventative because if you don't know what causes it, you can't prevent it. But proactive, I think just letting people know that, periods that are painful enough to make you pass out are not normal.
Right.
Periods that make you anemic are not normal. I've had that.
Right.
Periods that, or pain that knocks you out for, 2 or 3 days on a regular basis, it's not normal. And also that there's so much misinformation because, a few gynecologists said to me, like, okay, well, there's no pattern there in your pain. So like, it can't be that. there is no pattern. All of the pain, and every woman has slightly different symptoms,
Right.
and to be aware of that, and to also be aware that like so many different things, Dr. Arbuck says that, you can have pain in so many different ways because your nervous system is on high alert,
Right.
so everything will fire off a pain response.
Right. I've talked about a number of times, even in the talk with Dr. Yondorf, we talked about pelvic pain and the chronic pain response.
Mm-hmm.
We talked about that. But it's such a simple thing. It sounds like such a simple thing, which is to listen to the patient and validate them. If if your doctors had done that, right, you would have been in a different place.
Well, you know what? Some of them actually did validate me. They just really didn't know what to do for me.
Mm-hmm.
And I don't know. That I do think that that's changing though.
Right.
I do.
Right. But I think what was harder was when people didn't validate you and told you, okay, everything's normal, and why are you here again?
That was, I still can't believe that she said that. Oh, and another thing that was told to me as an option for management is now she talked about it. Dr. Yondorf talked about it, and now I can't remember. It's like, a whole bunch of letters like agonist. It's something to
Right,
like
the GnRH, yeah.
Yeah, the medication there's either a shot that can, injections or an oral medication
There's
that
an oral one that's actually an antagonist instead of an agonist. One or the other, I can't remember either.
No, there are two. There are two. There you can either do it with injections or orally,
Right,
and
right.
it brings on menopause. And I know that sometimes it's necessary to do it. I know people do it for fertility things also. And also, well, I'll get back to that in a second. But there are a lot of, side effects that are unpleasant. That was also told to me like, oh, why don't you just do that? And then other doctors said to me like, oh, don't do that. That's terrible. And one doctor said like, you could try the oral one, and if you hate how you feel, you can always stop it, and then it will, all of that will stop.
Right, because Lupron is an implant. You have it in you.
Yeah, but also, those are really just, first of all, you can't do them forever. I think it's only for 3 months.
Right, they don't cause menopause. They just halt the hormonal changes.
Yeah. It's like a chemical menopause for, a short period of time. And why would you do something that's only going to help you for 3 months? Like everything will come back. One woman in my group was told to get pregnant to stop, to help her endo.
That's a solution, I guess. Right.
Well, if you're pregnant, most of the time, the hormones will, put the pain into pause, but it doesn't stop it, and you can't be pregnant permanently. So
right.
She was told that by her doctor. I'm sorry, I should have clarified. Her doctor told her she had just had a baby and her symptoms came back, and the doctor said, well, until we can figure out what to do for you, why don't you just get pregnant again?
Right.
Yeah.
Well, we definitely need more doctors with expertise in this area. That would really help.
Mm-hmm.
Would you say that's true?
I think definitely need more doctors that have expertise in this area. And beyond that, more doctors that are not experts in it, but that know about it well enough to know that I'm not an expert in this, but this is, a suspicion. Here's somebody who can go check it out for you.
Right. You have to know what you know and know what you don't know.
Right.
Which is what I dive in before I go to work every day.
That's so beautiful.
Yeah. I dive in that I should know what I know and know what I don't know, and treat every person with dignity and respect.
Wow.
And that's what everybody should do. It sounds so simple. It sounds so simple, right?
It sounds so simple, but it's so big. Like, it's really so beautiful. Your patients are so lucky.
It's hard, I have to say. I dive in it, but it's not as easy to put it to actual, real life. It's hard. We're under a lot of pressure, right? And there's constant flux of knowledge. It's really hard. Right. But I'm here for your side of the story and your experiences. And I have to tell you that it was so incredibly generous of you to share this. And first of all, you should have a complete refuah.
Thank you.
I dive for you. You know that, right?
Yes, thank you. Also,
I'm still davening. Still davening.
Yeah. Thank you. Thank you. I'm so touched by that. Thank you.
You know, I mean, you had, like I said, it's an Odyssey. You had this massive 10-year journey.
It was a massive journey, and I have to, validate that for myself. And at the same time, I'm also able to, like I said, everything happened at the time it was supposed to happen. I recognize that. But one thing that I recognize all the time is that this happened after I had my kids. For me, the timing was, I guess I can't say the timing was good, but the timing was lucky for me because so many women have this interfere with their, getting pregnant, staying pregnant, causes fertility problems, and sometimes
So when you say that, that's more endometriosis than adenomyosis, by the way.
I don't even know.
It is true.
Actually.
Yeah, we talked about this with Dr. Yondorf.
Okay, well, and obviously, if you have adenomyosis, and you want to have kids, you cannot have a hysterectomy.
Right.
So, that takes one option off the table for relief, for a cure for you. Right. I mean, that is the only cure. You can only cure adenomyosis, and you cure it with a hysterectomy. Everything else is treatment and management.
Right.
But yeah, so I'm really grateful for that. I have to, recognize that, which is another thing for people to know. It's you have to find the right people, because sometimes this is tied in with your fertility and having kids and infertility, and it's so sad when there's so much going on.
Absolutely.
But also makes it so important to find the right people who can help you.
Right. Well, that's really a really important take-home message. Listen to your gut and find the right people. If you have to summarize it with two things, that's what I would say.
Yeah.
You have a third?
You know what? Be kind to yourself.
Right.
Because, there were times when I said, like, okay, what's wrong with me? Why can't I handle this? Well, because there was something wrong with me and I couldn't handle it. and I shouldn't have had to. And then also, like I said, the times that I pushed myself, recovering from surgery really made me have to not push through the pain. Right. And not have to do things because, and I was tempted to a lot of times, but I had to stop myself and say, you know what, you can't, you want to recover from this the right way. And at least that. But really, if you're in pain, then you shouldn't have to push yourself either. I mean, right. Obviously we all have to do what we have to do every day, but, and if, you're not going to do surgery for whatever reason, I mean, even endo, it can be expensive. It can, there are many reasons that people might have to not do surgery. Do your research and find out how to manage it. And because I really did do a lot of research, and I found out about a whole bunch of hormonal options that were just not, and the more I learned about it, the more I learned, no, I don't want to do this. So after that first time that I got bullied into it, I said, no, I'm not going to. So do that. Like, don't let yourself get bullied or bulldozed into something that doesn't feel right to you. Do your research. Know that, yes, if you don't want to do surgery, there are other options. So if you're being told, oh, surgery is the only answer, it's not always.
And medicine is constantly changing. So what we're talking about right now, right?
Yes.
What is this, December 23rd, 2022? Is that today? Yes.
No, it's the 22nd.
22nd. December 22nd, 2022. It changes in a heartbeat.
It changes. Yeah. Right.
Yeah.
Right.
So people have to keep that in mind, especially I think this is a rapidly moving field. I think that there's really just an increasing, like you keep talking about, in the past 2.5 years, there's more awareness. That's rapidly changing.
Mm-hmm. Yeah, so which is a good
important
thing.
Yes, thank God. No, and like I said, people like you who are talking about it are helping, really, really helping.
That's why I'm doing this, because I learned a lot from other people, and this is so not the kind of thing I normally do.
Right. No, it's really putting yourself out there, even anonymously, right? I'm adding an addendum to this talk because my interviewee correctly pointed out to me that when I mentioned endometrial ablation, I was incorrect in this context, because endometrium is the lining of the uterus, and I'm not talking about, in this context, getting rid of or ablating the entire lining of the uterus. I was referring to endometriosis ablation, or ablation of endometriosis lesions. And by the way, this shows how many patients become so knowledgeable I am not an expert again in this at all. I'm a pediatrician, and I need to be humble enough to correct myself, also because I don't want to obviously mislead the audiences. So again, when I referred to endometrial ablation, I was incorrect. I meant ablation of endometrial lesions, or endometriosis ablation. And while I'm here making a postscript, I'm going to point out again at the end of the story that everybody's situation is different. This is my interviewee's story. It is her lived experience, but please, I want to advise caution that this is not medical advice. And there are different ideas about this, that there can be a time and a place for ablation of endometrial lesions as opposed to excision. So I really recommend that you do not take this as medical advice, and you do get a good clinician to work with. I will also mention again, as I did at the beginning of the talk, that a lot of these clinicians who are endometriosis specialists do not take insurance. So you have to be very cautious with that. So again, I think it's very, very important to listen to your own gut, to be a good advocate for yourself, and to seek clinicians that are knowledgeable and experienced and will listen to you and partner with you.
Thanks for listening to the JOWMA Preventative Health Podcast. If you've enjoyed this, please rate and review us on Apple Podcasts and share this with your friends. For more information, check out our Instagram at JOWMA_org. Check out our website, www.jowma.org, that's JOWMA.org, or email us at health@jowma.org.